The tubes that branch off from the trachea and lead to the lungs are called bronchioles, alveoli, pharynx, epiglottis. So the correct answer is option A. The tubes that branch off from the trachea and lead to the lungs are called bronchioles. The condition in which there is a buildup of fluid in the lungs, making it difficult to breathe, is known as pulmonary edema, pulmonary fibrosis, pulmonary embolism, pulmonary hypertension. So the correct answer is option A, pulmonary edema. The trachea is also known as windpipe, alveoli, bronchioles, diaphragm. So the correct answer is option A. The trachea is also known as a windpipe. The medical condition in which air leaks into the space between the lung and chest wall, causing the lung to collapse, is known as pleuritis, pneumothorax, hemothorax, pleural effusion. So the correct answer is option B, pneumothorax. The medical condition in which there is blood in the pleural cavity, causing chest pain and difficulty breathing, is known as pleuritis, pneumothorax, hemothorax, pleural effusion. So the correct answer is option C, hemothorax. The condition in which the air sacs in the lungs become inflamed and filled with pus is known as emphysema, pneumonia, bronchitis, asthma. So the correct answer is option B, pneumonia. In addition to respiratory function, the lungs also play a role in excretion, temperature regulation, pH regulation, maintaining the balance of body. So the correct answer is option B. In addition to respiratory function, the lungs also play a role in temperature regulation. Why is exposure to carbon monoxide harmful to animals? It reduces CO2 transport, it reduces O2 transport, it increases CO2 transport, it increases O2 transport. So the correct answer is option B, it reduces O2 transport. When blood carbon dioxide concentration rise, what happens to the breathing rate? Remain unaffected, decrease, stop, increase. So the correct answer is option D, increase. What happens during inspiration? So the correct answer is option D. During inspiration, the diaphragm gets flattened and ribs get raised. A normal man at rest inspires and expires about 500 ml of air. What is this amount known as? Complemental volume of air, tidal volume of air, reserve volume of air, residual volume of air. So the correct answer is option B, tidal volume of air. After a normal expiration, the volume of air that remains in the lungs is called residual volume, vital capacity, expiratory capacity, functional residual capacity. So the correct answer is option D. After a normal expiration, the volume of air that remains in the lung is called functional residual capacity. What is the covering of the lungs called? Pericardium, pleural membrane, peritoneum, none. So the correct answer is option B. The covering of the lungs called pleural membrane.